This is CBS 6 News in high definition.
Plus, Obamacare rollout, a key part of the Affordable Care Act, kicks in tomorrow. Tonight, we kick off a week-long breakdown of everything you need to know. Well, as we've mentioned, House Republicans want to delay the implementation of Obamacare in exchange for avoiding the government shutdown, but it appears that will not happen, which means the health exchanges here in New York will go live tomorrow. Here are the facts first. The individual health exchanges for the 2.2 million New Yorkers who are currently uninsured. You'll be able to go online tomorrow, search and sign up for coverage. The group health exchange will be used by those who work for businesses with fewer than 50 employees. If your owner decides that's the best way to offer you coverage, you'll shop there for a plan for next year. It is expected that 3/4 of those who enter either of these exchanges will be offered government subsidies to help offset the cost. Jennifer Lukey has been leading our coverage on the Affordable Health Care Law. She joins us live now with a look at how everyone behind these exchanges is gearing up for an onslaught of interest.
Well, Jerry, really, this is the not so calm before the storm. When these go live tomorrow, these exchanges, people are going to be able to go to the website, put in their information, put in all of everything they need, their social security number, their financial information, everything will go in. And basically what it will do is spit out a bunch of information, a bunch of options for you to go through. Now, technically, this should go off without a hitch. But when you've got all these different agencies involved, when you've got all these different businesses, these insurers involved, and technology, things might get a little sticky.
This is fairly unprecedented, and certainly in healthcare, this much being done in this short a time.
When it comes to offering millions of people insurance in a new and much different way, there are a lot of variables.
There's a lot of information that has to go back and forth between the health plans, between individuals, between the federal government and the state government, and it has to happen in real time. It's a pretty complex system.
And there's likely to be some kinks come tomorrow.
The what-abouts go away, and the if-thens go away, and then we're back to reality. So, and we'll see. Now, we're stress testing a system now.
But the true test comes tomorrow. That's when nystateofhealth.ny.gov goes live. Those who need to pay close attention are folks without insurance at all right now. The individual exchange is where you'll do your shopping.
We're expecting to see somewhere around 600,000 people come into the individual exchange over the next couple of years.
If you work for a company with fewer than 50 employees, wait for direction from your boss. Starting tomorrow, he or she will be able to look at the group plans on the exchange and then decide whether to offer you that coverage or the more traditional plans you're used to.
And it's going to depend on whether or not they'll be eligible for those premium tax credits. So it's going to be dependent on the makeup of their employee base, whether or not going to the shop exchange will be more beneficial for them.
And even if your boss decides you'll be shopping in the exchange, you have plenty of time.
Take your time. You don't have to make a decision on October 1st. You don't have to make a decision on October 10th because the coverage isn't effective until January 1st. You have time to do some homework.
Now, again, technically, everyone will now be required to have health insurance. If you don't, you'll have to pay a penalty to the government. Uncle Sam will come knocking. Next year, it's $95, which for a lot of people is very, very much cheaper than actually buying into one of these exchanges. And coming up at 5:30 in our Say What segment, we'll talk with some of those young, healthy people about whether they're going to pay the penalty or they're going to pay the premiums. Live in studio tonight, Jennifer Lukey, CBS 6 News.